Welcome to Part 1 of It Takes a Village. The entire presentation is divided into 3 parts: developmental promotion, developmental screening, and connecting to services. It is accompanied by a toolkit that includes links to online resources and trainings, as well as printable resources such as tip sheets and informational handouts. The presentation's overall purpose is to promote awareness and implementation of universal developmental monitoring, screening, and follow-up in order to maximize young children's development. The intended audience of this presentation consists of all disciplines of early childhood consultants, other early childhood support professionals, and early care and education providers and administrators. For the purposes of this series, early care and education providers refers to all early childhood settings where young children are receiving care and/or education. These settings include center-based programs, family child care, preschool, early Head Start and Head Start programs, and the like. Parents and families can benefit from the information included in the toolkit. Approximately 15% of children ages 3 to 17 years old either have or are at risk for a developmental delay, such as a language delay, attention disorder, or a social and emotional delay. Children living in poverty or in the child welfare system, especially those who have experienced abuse or neglect, are more likely to have developmental delays due to the circumstances of their environment. Developmental delays which are not identified early in life can have a profound impact on children's ability to learn and consequently long-term effect on their development, health, and life course. For these reasons, early identification, intervention, and family services are critical. Many resources are available to correct delays, but early detection is the first step. Developmental screening is viewed most beneficially as part of a continuum consisting of 5 parts. The first is developmental awareness and promotion, which involves all young children. It incorporates providing information to early care and education staff and families about developmental stages and activities, implementing a policy for monitoring and screening, and developmental monitoring activities. The remainder of this presentation will focus on this first part. Developmental monitoring is a routine gathering of information about a child's development and behavior, noting concerns when present. It is generally accomplished by conversation and observation. A periodic review of a child's developmental milestones at key ages as compared with typical development is completed within a continuous process of families and ECE providers sharing their observations and concerns, information, and resources. Developmental monitoring creates a longitudinal record of a child's progress. It is often referred to as developmental surveillance. Using monitoring checklists are very helpful in this process. See the next few slides for some monitoring tools. Developmental milestones are skills that young children show us for the first time, such as a first step, smiling, waving bye-bye. Starting at birth and continuing throughout childhood, children reach milestones in how they learn, speak, act, play, and move. Remember that monitoring developmental milestones is an ongoing process. There are a number of Connecticut-specific as well as national resources that can provide supports for you in learning more about developmental milestones, the importance of developmental screening, and the services that are available to support children's healthy development. This slide has links to both Connecticut and national resources that you may want to check out. The Centers for Disease Control and Prevention's program called Learn the Signs, Act Early provides a selection of free web-based resources and training to support ECE providers on developmental monitoring. The CDC has developed materials to help you educate families about developmental milestones, including what to expect and when to be concerned about their child's development. These materials are not a replacement for the developmental screening you conduct, but they help families to become better informed partners in monitoring early development. With these resources, families can base their observations on objective, research-based, age-appropriate developmental milestones. If you already have resources you like to use, these materials can supplement them or fill gaps. They use family-friendly language and have been tested and well received by families. The content is provided by the CDC and American Academy of Pediatrics, so you can have the confidence in their accuracy and credibility. Here is a sample of a milestones checklist. It includes 4 domains of development, as well as a separate area for developmental red flags, which are observations that are important to bring to your attention. These checklists can easily be printed out from the CDC Act Early website and reproduced as needed. This is a sample of the Milestones Moments 46-page booklet. It lists the specific milestones to look for when a child is between 2 months and 5 years old. Parents can follow their child's development by watching how he or she plays, learns, speaks, and acts. They can also help their child's development by following some of the recommended activities. Families are critical partners in the developmental monitoring of their children. To establish this philosophy from the beginning, remember to follow these simple yet important guidelines. Make monitoring a routine practice with every child and family. Have regular conversations with families, sharing mutual observations that include the presence of strengths and any risks. Inquire with families about developmental screening at their child's pediatric primary care practice, and suggest that parents can share results with their child's primary care provider. And finally, encourage families to contact the Child Development Info Line to enroll in its Ages and Stages Monitoring Program. This program will be covered in Part 3. Thank you, and be sure to visit the toolkit for more information.